welcome all of you to the launch of our historic first contract negotiation. We are here to elevate women's and family health for generations of Pittsburghers. We're here to elevate the nursing profession throughout our entire region. Right. My name is Lucy Rose Ruscio. I'm a nurse practitioner in the neonatal intensive care unit at Magee Women's Hospital, and I also work at UPMC Children's. Like all of my coworkers here today, I am deeply proud to carry out the mission of Magee Women's Hospital every single day. I'm also so proud to have been part of the tireless, hard work of nurses across our hospital to overcome a very aggressive and expensive anti-union campaign to get here today. We are here today so that we can meet directly with UPMC. We are even stronger today. We are even more united today than we were then, and we are more determined than ever to make real progress. We were able to get to this moment because we were not only focused on improving our own working conditions, but we were also always focused on the care of everyone in our region. We would not be here without the incredible support of all of you and nurses across our city. So from the bottom of our hearts, thank you. Thank you to everyone who showed up for the past 2+ years, and thank you to everyone who showed up today. You are essential partners in this effort, and that's why we want to hear from you. Quickly, I want to shout out a few people I've seen here. I'm sure I'll miss a few, but we've got our day one Allegheny County Executive, Sarah Navarado. We've got Allegheny County Council members, Lisa Geiger-Schulman, Alex Rose, Kathleen Madonna Emmerling, and then we have a huge showing from our brothers and sisters in the labor movement of Pittsburgh. We've got John Liska, the president of Allegheny County Labor Council. We've got reps from United Steelworkers, the operating engineers. We've got Unite Here, Pittsburgh Federation of Teachers, and even the National Association of Letter Carriers. Thank you all so much for being here with us today. You are essential partners, like I said, in this effort, and that's why we want to hear from all of you. Today, we're taking a groundbreaking and innovative approach of calling for the direct experiences and perspectives of our patients, of our community members, and of our non-union nurses at every hospital in the region. We're asking everyone to visit, ready, elevatingpghhealth.org to make your voices heard. Go visit elevatingpghhealth.org. We will closely review the input, which will help shape our contract proposals. The mission of our negotiations is simple, and it's the same as what drove us to form a union in the first place. We want to put the humanity back in healthcare. We want to put the humanity back in healthcare. We want more time with our patients, and we want to make our majority women profession sustainable. This mission is extremely urgent because our patients need more care from us than ever before, and the nursing profession is in crisis. Women's and family health in our county are facing serious problems, and there are alarming racial and class disparities, including in maternity and infant mortality. At the same time, our state is facing the worst nursing shortage crisis in this entire nation. The lack of evidence-based, nationally recognized staffing standards forces nurses to constantly rush through our duties, causing moral injury, exhaustion, and burnout. And a lack of professional benefits and compensation drives experienced nurses from the field and creates a constant churn of new nurses cycling through. We recently surveyed our coworkers at Magee about how best to address these crises. From that process, we created the broad outline of our contract goals. which will be further guided by community input moving forward. Our proposals include more time with our patients, more time with our patients through evidence-based national staffing standards that our community hospitals. We want affordable health care so that we can be healthy for our patients. We want compensation that rewards and retains experience. We want real parental leave that allows us to care for our newborns and ourselves the way we care for you. We want freedom for all UPMC nurses and healthcare workers to form a union and to have a voice on behalf of their patients. No one should have to go through what we want safety and real security for our patients, family, and staff, and a range of other policies to support our well-being so we can have lifelong careers at Magee. In order to address the serious challenges facing women's health and family health, we have to elevate care standards at Magee. This is the area's preeminent women's care provider. And in order to address the nursing crisis, we need to elevate nursing standards at UPMC, which is the Commonwealth's largest healthcare system and employer. We are looking forward with joy, excitement, and optimism to building a productive, collaborative relationship with UPMC to address the systemic challenges we are all facing. Now, I'd like to introduce our very first speaker, who has been a longtime champion for women's and children's health. Please give a loud and warm welcome for County Councilwoman Lissa Geiger-Schulman.
Thanks, Lucy, and it's an honor to be here with Magee nurses and advanced practitioners and to stand with you. I'm truly in awe of the long and hard fight that you put up to earn this union, and I want you to know that you all are leaders and models in the healthcare industry. I hope that your colleagues across the region and across the state are watching. You're exhibiting what it looks like to show up and win, not just for yourselves and your families, but for your patients, for the families in our region, and for our entire community. As employees of a major employer here in our region, your contract is going to help set the standards by which so many other employers decide what's right and what's fair. Thank you for leading in this space. We know in our community, maternal and child health is facing serious challenges. Lucy referenced it a little bit already. As a professional who works in this area, every statistic I see day in and out shows that we have major challenges in our country, in our state, and in this region specifically as it relates to maternal and child health. In 2018, the Federal Health and Human Services Bureau approved a framework of Healthy People Goals for 2030, and tracking against these national objectives, our region is very much falling behind. Whether you're looking at preterm births, which in Pennsylvania are about 9.7%, and Allegheny County's rate is above that at 10.2%. Meanwhile, the 2030 goal is to get to below 9.4%. We're behind. Looking at severe maternal morbidity caused by everything from hemorrhage, respiratory conditions, cardiac complications, renal complications, sepsis, and other complications. All of this has been on the rise over the last decade, and Black mothers are experiencing morbidity at twice the rate of white moms. This is shameful. Finally, infant mortality. Pennsylvania has a rate of 5.6 infant deaths per 1,000 live births. Allegheny County is at 6.2. Meanwhile, the 2030 goal is to get to 5 or less. We are again behind. The cuts and the chaos happening at the federal level are making it incredibly challenging for policymakers like myself and my colleagues who are here to support to develop public health programs that improve these outcomes and fund them sustainably. Meanwhile, the nurses and practitioners who are here today know these statistics better than I do, better than any of you do. They see them every day. The complications, the medical events, the growing family mental health needs, the need for income for basic needs that new families have. Food, formula, diapers, housing, transportation, affordable health care. All of these costs add up, but they must be in place in order for children to develop and be healthy, especially during a critical transition to life with a new baby. Parents need to be able to focus on the bond with their child, attention and care for their child's development, and when they're concerned with those other things, whether it's nurse employees or anyone in their community, our communities will not thrive. As a mother myself, who gave birth at Magee 3 times, I remember my own journey, processing experiences that range from joy, wonder, fear, overwhelm, anxiety, and exhaustion. Having the support of professionals like these was absolutely critical to navigating my first days of motherhood. Knowing their time with me could be the difference between getting connected to a service or not. I know I went with a stack of referrals from everything from lactation support, mental health, nutrition, pediatric care, and ongoing nurse follow-ups, which were critical for my family to thrive. For other new moms, those connections might include things like Help Baby, referrals for home visits, early intervention, quality childcare, or family support centers. Again, as a professional working at the intersection of early childhood and maternal child health, a child's long-term success against every measure, whether you're looking way far out to third-grade reading scores and school attendance, or much closer to child well visits and pediatric care and chronic health. They all begin with the help of pregnant women and infants in those first critical days and months of life. Caregivers cannot pour out from empty cups. They cannot be at their best if they are not cared for themselves. Worrying about their own healthcare costs, the ability to feed their families, or having time to care for their own children and families means that they will not be able to show up and offer their best support to patients. The contract that these nurses and advanced practitioners are going to win will improve the lives of our most important regional employees, the patients and families who call this region home. So thank you for what you do, and let's keep fighting.
Thank you, Councilwoman Geiger, for those moving and powerful words. Next up, I'd like to introduce my nurse coworker and fellow member of our negotiating committee, Amaya Edward.
Hello. It feels so good to be here with all of you today. My name is Magee, and I've been a registered nurse for about a year and a half. I work at Magee's first sector. I get so much fulfillment from being a labor and delivery nurse, which allows me to channel my nurturing side and to use my critical thinking skills. And we are called on to use all of that every single day. Like every new nurse in the city, I've watched so many fellow nurses leave the bedside. This profession is in crisis because it has become unsustainable. As nurses, we are proud to take care of the most complex, most high-risk cases from across the region. We show up ready to problem solve and work hard for those patients, but we are regularly spread way too thin. When women go into labor and give birth, it takes time to unfold. It cannot be predetermined according to a clock or a budget. In order to fully be with patients the way that we were trained, the way that we deserve, we need more time. Time for one-on-one attention, time to listen, and time to fully assess. And it does not always go according to plan. Recently, I had a patient whose baby had died. She needed her nurse to be by her side that day. That was where I needed to be. To help her and her family understand, to cope with the grief and answer all their questions, not just rush through my duties. But I felt torn. because I also had another laboring mother who needed me. We're constantly forced to sacrifice one patient's experience for another's. We try to make up the difference by cutting down on time for ourselves in order to give more time to our patients. We don't drink enough water, we don't take our breaks, and worst of all, we go home plagued by all that we were not able to do. It's easy for nurses to feel like these are individual feelings, but in fact, this is a systematic failure. This is why nurses leave. At just 1.5 years, I'm assigned to train even newer nurses because there are too few veteran nurses on our unit. And with such high acuity, it's hard to find the time to really give them the support and the teaching that they desperately need. Nurses at West Penn Hospital work with their administration through union negotiations to establish national staffing standards set by the Association of Women's Health Obstetric and Neonatal Nurses, also known as AWON. They brought evidence-based birthing care to Pittsburgh, and we believe that our patients at Magee deserve the same. United, together, we are determined to work towards just that. So today, I'm inspired and I'm hopeful because of how far Magee nurses have already come, and seeing nurses take action together across the region and across the country. Shout out to the 15,000 New York City nurses on strike for their patients. Shout out to the nurses at UPMC Altoona who just won major investments in retention, recruitment, staffing, and safety. And shout out to the nurses at UPMC, West Penn, and HH for paving the way for all of us to walk down now.
Thank you, Amaya, for sharing your experience. Now I want to welcome a very special speaker who Magee nurses have the privilege of caring for when she delivered her child at our hospital. Please welcome Caroline Badashevsky-Miller.
Good morning. My name is Caroline Badashevsky-Miller, and I had the life-saving good fortune to be a patient of UPMC Magee's maternal fetal medicine department from the start of my pregnancy through delivery in 2023. The exceptional level of care, skill, professionalism, and dedication of these nurses cannot be overlooked or diminished. It needs to be protected and supported. I can say personally, it would be life-threatening to not do so. I am here to champion it. The birth of my son was fraught with unforeseeable and potentially fatal complications. And at this point in my life, I am very familiar with medical anomalies, surgery, and trauma. As a 3-time open heart surgery, congenital heart defect patient, with scoliosis and missing kidney, it's okay, Sonny. Come here. As a 3-time open heart surgery congenital heart defect patient with scoliosis, a missing kidney, and only half a uterus, my pregnancy was high risk from the very beginning. And UPMC Magee was there. Yes, yours. My water broke at 34 weeks, and I was immediately admitted for monitoring. When a necessary C-section after 19 hours of labor turned emergence, a Magee nurse who will always be my hero was the first to hold my baby as I was rushed into emergency surgery for a uterine rupture. She checked on me and advocated for me throughout my 7-day hospital recovery, in addition to caring for her other patients. When I woke up after being sedated and intubated for 18 hours, I was told it was a delivery unlike anything they had seen before. My uterus was torn open during the delivery. I lost well over half my blood volume. I went into hemorrhagic shock. My son's head had been stuck in a ring of uterine muscle due to a very rare uterine deformity. Upon delivery, the initial fear was that his neck was broken due to the force it took to get him out. And yet, aside from a tibia fracture and slight black eye, at 4 pounds, 6 ounces, he was strong and perfect. Stable. I finally met my son after 36 hours after he was born. I missed his first cry, but I will not miss his life. At a lesser hospital, with fewer and less prepared medical staff, I know all too well the outcome could have been very different. Due to the extensive trauma, I'm told my uterus is now Frankenstein together. Along with my pre-existing biological failings, I am unable to have any more children. This has been a painful reality to accept, but because of the incredible team of nurses and doctors throughout UPMC Magee Hospital, I am here. My son has his mom, my husband has his wife, my parents have their daughter, my 5 siblings have their sister, my family has a grandson. Because of the undeniable skill, hard, unceasing work, and relentless resilience of Magee nurses and medical staff, I am here to raise my son. He is here, right here. And he is extraordinary. I trust these nurses. I trust these nurses with my life. I trusted them with my baby's life before I even met him. And I trust them when they say they need more time and support to provide the very best care and make their careers sustainable. I am excited to fill out the online survey that Magee nurses have launched, so I can share my personal perspectives about why it is absolutely imperative to elevate women's health and the nursing profession in our region. I stand firmly and proudly in support of the nurses' union efforts, just as all of them stood with me, with tireless strength, dedication, and endless care for their patients and community. Thank you.
Thank you. I feel like that's sort of everything that anyone needed to hear. Thank you so much for sharing your story, your courage, and your power. Now, please let me welcome a leading expert on nursing and women's and family health, Dr. Nancy Vincent, who is the coordinator of the Nurse Midwife Program at the Pitt School of Nursing.
I've been an RN since before Amaya was born. and a nurse midwife practicing here in Pittsburgh since 1995. I was a member of the first bargaining committee for the nurses union at Allegheny General. Thank the members of your bargaining committee. It's a really hard job. Make them a casserole, offer to babysit, they're going to need the help. Currently, I'm the director of the midwifery program at Pitt and a member of the Union of Pitt faculty. I'm also a perinatal epidemiologist, and I study labor and also maternal mortality. So I'm here today to talk about two related crises. One is the crisis in maternal mortality, and the other is the crisis in nursing. I recently completed a 6-year term on the Pennsylvania Maternal Mortality Review Committee. This is a multidisciplinary group throughout the state that meets monthly and reviews the cases of every single woman in Pennsylvania who dies during pregnancy or in the postpartum period. We determine if the death was potentially preventable, and if we think it was potentially preventable, what recommendations we can make so that deaths like that don't occur again. Our most recent report covered 2021, and during that time there were 129 pregnancy-associated deaths in Pennsylvania. Okay, so here are, I only have a few numbers. I like numbers, but I just put in a few. But here are the important ones. First of all, deaths were twice as common among Black women as white women in Pennsylvania, which is completely unacceptable. The second completely unacceptable number is that of the deaths from pregnancy-related causes, 98% of them we determined were potentially preventable. So let that number sink in. 98% of maternal deaths might have been prevented with better care. So here's a little pop quiz. Do you think that our recommendations to improve that care and reduce maternal mortality were to get fancier equipment and better medications? No. No. They primarily come down to better continuity of care, letting patients see the same providers on a regular basis, and giving nurses and providers more time to spend with their patients. We need enough time and continuity to build trusting relationships with patients so that they trust us enough to feel comfortable reaching out to us when they have a problem at home in the postpartum period. They feel safe calling 911. They feel safe calling their midwife or their nurse or their doctor or their home visitor. We need enough time to thoroughly assess them for substance use, mental health issues, intimate partner violence, and social determinants of health, and then make in partnership with them good plans to address these issues. We need enough time to make postpartum follow-up appointments for them, and then call them if they don't show up. We need enough time to give good basic nursing care, and that's what's going to affect maternal mortality in Pennsylvania. And this brings us to the second crisis, the crisis in nursing. We want to do all these things, right? We want to take great care of our patients. We sure didn't go into nursing because the hours are so great and the working conditions are fantastic. We want to take care of our patients. And when our employers require us to do prenatal visits in 10 or 15 minutes, or to take care of 3 women in active labor at the same time, we suffer from what's called moral injury. This means we can't provide care that matches our values, and it leads nurses to burn out, get depressed, and decide we'd rather sell real estate. There's a national shortage of nurses. We cannot afford to have highly skilled nurses burn out and leave the profession. So today, you all are acting together to address these crises. By working together to achieve better staffing ratios and working conditions, you will improve conditions for nurses, midwives, nurse practitioners, all providers, and for all the childbearing families in our community. Magee is a national leader in so many areas. You can't open an obstetrics journal without reading articles by Magee staff. Magee can also be a national leader in improving patient outcomes by improving conditions for nurses. So I encourage everyone to be involved in this effort. Being here today to support the bargaining committee is one step. The next step is completing the online survey. And remember, a union isn't a bunch of outsiders telling you what to do. The union is all of you, all of the nurses, all of the nurse practitioners, all of the midwives. And all of you working together can improve the health of women and families in our region and serve as a national and state model. Thanks again for all the work you do taking care of women and families in Pittsburgh.
There's a good one coming up next. Next up, we have Magee nurse Roseanne Berube, who we also secretly say we would like to elect a president of the world.
Thank you. It's very, very humbling. As Lucy said, my name is Roseanne Berube, and I have spent my entire 44-year nursing career at Magee. Almost all of that time has been as an oncology nurse. Are you surprised? The OB hospital. And I currently work in the Women's Cancer Center, which is the only one of its kind in our region serving women exclusively. Nursing is my vocation, as well as my career. And as a Christian, I feel called by my faith to serve others and relieve suffering. I say, let's return our country to humanity. I'll be retiring at the end of this month from my full-time position. But I'm involved in these negotiations because I want to leave a legacy for future generations of patients and nurses. Over the years, it has been depressing, talk about moral injury, to witness the decline of the healthcare system in this profession that I have given the majority of my life to. I watched the evolution of acute care nursing go from being patient-centered and provider-led to profit-centered and business-led. I want to lead a healthcare system that involves nurses in decision-making instead of turning a deaf ear to our needs. Where nurses have the time with our patients that allows us to truly carry out Magee's mission. A system that rewards and retains experienced nurses instead of capping the wages of nurses like me. A system that provides professional benefits like affordable health care and sufficient paid parental leave, that recognizes nurses' skills and allows this majority woman workforce to provide for their futures and families. And I want to leave a health system where every nurse and healthcare worker has the fundamental American freedom to form a union. Right. The anti-union harassment from our employer and the toll it takes focus on the mental health of nurses. For us, we had to endure a daily anti-union campaign with misinformation written by high-paid corporate lawyers, and in my estimation as a nurse, very high-paid corporate lawyers, delivered to us by our supervisors, fed to them by administrators. Our employer refused to allow nurses a room in the hospital to just meet together, decide, and move forward. Instead, we were told not to talk about our union, our pay, or the important patient care issues that prompted us to organize.
Shame.
Yep. Instead of recognize our union and sitting down to work on improvements, our employer used legal tactics to delay recognizing our union. This kind of daily anti-union campaign creates a hostile workplace and distracts from our very important direct patient care.
Right.
It is draining, it is demeaning, and a waste of nonprofit resources. At Magee, we are the healthcare professionals entrusted with some of the highest risk medical cases, as you have heard. Yet when it comes to deciding if we should have a voice in our workplace, which by the way is our federally protected right, the health system we work for does not trust us to make that decision. We all want to build a relationship of trust and collaboration with UPMC moving forward. But we cannot work together at the negotiating table while they fight other nurses who are trying to join us in our union. So my hope by the end of these negotiations, I am leaving behind a health system where all nurses are free to unite together so we can have the strongest voice for excellence in women's and family health care and for the future of our profession. Thank you.
Honestly, she can have whatever she wants, including a speech. I believe up next we have Sarah Inamorado, who is our county executive and who has truly shown up every single step of the way alongside us. We could not be more thankful for her support.
Well, good morning, everyone. And thank you all for being here, members of our labor movement, the community, families. Thank you for coming together to support the UPMC nurses and advanced practice professionals. Can we give them another round of applause? I don't know how you sit here and not be moved by the patient stories like Caroline's or the firsthand experiences like Roseanne. Just thank you, everyone who stood at this podium, for your vulnerability and really humanizing the data and pushing forward on what we know is right, which is a strong contract for UPMC nurses at Magee Women's Hospital. I do have to say, today I'm in a suit, but this suit stands with our nurses. You know, these negotiations, they're about something extremely simple, but extremely important to our entire region. Making sure that the people who deliver care have the staffing, the support, and the voice that they need to do their jobs well, right? You heard Magee nurses are at the bedside with women and families at some of the most joyous moments and also some of the most difficult. They deliver half of the babies that are born here in Allegheny County every single year. this formula. What's good for nurses is what's good for patients. And what's good for patients is good for our entire community. You know, as your county executive, I run a health department, I run the Department of Human Services, and we spend a tremendous amount on public health supports, and specifically programs that are focused on positive outcomes for women, for families, for babies in our region. And the professionals at Magee are crucial partners in delivering those positive outcomes. And you've heard it here on repeat that we are facing a nursing shortage. So retaining experienced nurses at the bedside is essential for quality care, patient safety, and the long-term strength of healthcare that serves us all. Nurses know what their patients need best. They deserve a real seat at the table where decisions are being made about staffing, about resources, and about their working conditions. And as your county executive, I believe wholeheartedly in the right for workers to have a seat at the table and have their voice heard in their workplace. I believe in bargaining and good faith. We do it at the county many times over. And I urge UPMC to approach these negotiations with the same spirit, to view your people as an investment, and to give them the resources that they need to be successful in their jobs, because all of our success is tied together. And I've said it before, I've said it for the last 2 years in office, I said it as a state representative. This Allegheny County executive, Allegheny County as a whole, we stand with nurses. Negotiate a contract that delivers for workers, patients, and builds a robust future for healthcare across Allegheny County. Thank you.
Thank you again for all of your leadership during our entire journey here. Now we're going to wrap up and head into our first negotiation session with UPMC. I want to reiterate one more time our call for everyone in the community and all nurses to go to elevatingpghhealth.org to fill out our survey and make your voices heard. That concludes our press conference. All Magee nurses and advanced practitioners should head to the courtyard by Marriott.